Are you thinking, I feel older than I should? Maybe you're noticing brain fog, more fatigue, weight gain, joint pain, forgetting your words. What if I told you these aren't just parts of normal aging? They're signs of cellular function, they're signs of cellular dysfunction that can be reversed.
Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hello and welcome to the Feel Better, Feel Great podcast. Episode 153, The Science of Aging Backwards, Cellular Repair, Longevity, and Mitochondria. In each episode, we dive into the wonders of holistic health and functional medicine to empower you with the knowledge you need to lead a healthier, happier life. I'm your host, Dr. Andrea McSwain. And if you're new, please like, subscribe, and click the bell for this channel, Dr. McSwain. Please remember that the information provided in this podcast is for educational purposes only. Please seek the medical advice of your physician with any questions you may have regarding a medical condition or health objectives. So let's get started. Okay, so why are we feeling older than we are? Okay, first of all, there's a difference between lifespan and health span. Health span is a little bit newer of a word. Lifespan, obviously the length of life, right? Health span, the length of health. When we start talking about this, then we start thinking about what do we actually want. I often talk to people about healthy at 100, and they say, I don't know if I want to live to 100. And sometimes I get really sad with that because I understand, but I also think, wow, what if, 100 years just doesn't seem like long enough? And of course, we're always honored to celebrate the life of Dr. Gladys McGarey, who lived to be 103. And I will tell you, I was listening to Dr. Gladys McGarey on Instagram the week before she died. Her health span was remarkable, as was her lifespan. And I'd very much like to be helping people be healthy at 100. So what do we need to do about it? First of all, we need to recognize the problem. And one of the problems is the fact that we just accept that we're getting older, or someone tells us, oh, that's happening because you're getting older. And then we accept that, or we just don't know how to get out of it. Sometimes people come to my practice and they say, well, I was just told that's when I'm getting older. And I'm reminded always of the story of Isabella Wentz, who is a pharmacist who was told that she was just getting older. She had presented problems of exhaustion and brain fog. I mean, just unbelievable. She was told she was just getting older when she was 25 years old. I'm like, okay, well, that's kind of a cop-out. So I don't usually like to use the cop-out of, well, you're just getting older. I just don't think that's very professional, quite honestly. I do know we need to work on things. But first of all, we need to recognize the reversibleness of most chronic diseases, including some very severe medical conditions. So chronic, lasting greater than 6 months, dis-ease. And you may have heard me say before that if you break up the word disease into dis-ease, right, you can reverse this, right? You can go towards a place of ease. And so I do like to break up that word. I know, again, it's a little cheesy, but it's very helpful with the framework. And that's really important that we look at these ideas very strategically. We're given a body, we have a body, our body has all the systems in place, and then we just kind of like live in it until we die. And I don't really know that that's taking responsibility for our body, mind, emotional well-being, right? Just existing on the planet is maybe itself a chronic disease, because we know aging is its own disease, because our body rusts. I mean, there's stress, there's oxidation, there's inflammation, environmental exposures, toxic buildups. I mean, there's a whole long list of why the machine can wear down, right? And acknowledging that that's true and possible means that we can understand it better and we can work through it. And you might be finding some common signs of premature aging. Waking up tired no matter how much sleep you get. Struggling with focus, mood swings, brain fog. Maybe muscle loss and joint stiffness. Feeling inflamed all the time. So puffy, sluggish, slow recovery. Okay. I just don't really think that people sometimes want to draw the line like, hey, I need to take action. And maybe that's a little aggressive in me saying, but we recognize that aging is its own disease. And when you do that, you start seeing that where are you in the aging process and where do you want to be? I talked to several of my patients, and if you're lucky enough to be listening to this podcast and thinking about these ideas when you're in your early 30s or late 20s, that is such a blessing. Sometimes my patients come into my practice about that age, and we work on rehabbing whatever it is, gut, adrenals, hormones, whatever, and they start feeling amazing. And then they say, my gosh, I feel really good. What do we do next? We're done, right? And I'm like, well, let's talk about it, right? Because if you're feeling really great, right, you needed to feel better. And now you're feeling really great. And if you're feeling really great, it's not the time to stop taking care of these things. It's the time to stay on top of it and get stronger. Okay, so that's why it's feel better, feel great. Because it's just not enough to feel better. We actually need to be working on objectives so that we can reverse the aging process and maintain a vitality so that we have a very strong health span. Because we know that if you're struggling to not feel good, that there's mitochondrial decline, oxidative stress, chronic inflammation. Aging happens not just with time, but with cellular dysfunction. There's two categories of aging, right? I think there's chronologic aging, which is how old you are, your chronologic age. And there's metabolic aging, which is how old is your body. I have to give credit to Dr. Patel, who helped me appreciate this by saying chronologic aging is the number of times that you go around the sun. Okay, so if you've done that 47 times like me, then you're 47. But what are you metabolically? Can you run, jump? Does your gut always feel good? Does your heart race and makes you feel stronger, right? This is metabolic aging. Or do you creak and crack and, you're sluggish and blah, 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 blah. So that's, what do you estimate your metabolic age to be? So your chronologic age. What's your metabolic age? Is it about the same? Is it less? Is it more? People really have a sense of that. And then we recognize that aging has three main drivers: inflammation, mitochondrial dysfunction, DNA damage, and oxidative stress. Okay? These in excess can result in premature aging if left unchecked. But if we start to actually address these things, right? Addressing inflammation, making the mitochondria stronger, reducing oxidative stress. Therefore, we can have the DNA recover and repair itself better. These all happen at the cellular level. So this is very important because we have to recognize some of the other things that sometimes we don't have control over. And this is why some people age faster than others, but it doesn't mean they can't get control once they recognize that there's a problem. Obviously, genetics play a role, but lifestyle plays a significant role. When Dr. Perlmutter says you can have the genes, but it's like you don't pull the trigger. And in fact, you can sometimes do things to help you feel stronger. Ben Lynch talks a lot about methylation dysfunction. There are genes that support methylation, and sometimes people have genes that have a metabolic or a methylation dysfunction. So what do? You do more methylation, and as a result, you might take your methylated B vitamins so that they're more activated. So they come into your body a little bit easier in doing the work. So we can deal with genetics, okay? Environmental triggers matter more than your genes. And so is there a lot of pollution? Are there toxic pesticides in the water? Is there mold exposure and mold infection? Obviously, these are environmental triggers, but they can all be addressed. And they all need to be addressed because they can either accelerate aging, or you can help yourself and you can reduce aging. Also, how do we measure aging? I think this is really important because how do you measure aging? Like, I bet most people would say it's how I feel. Like, it's looking at the problem instead of looking at the optimization, right? So it's saying like, oh, my joints hurt when I wake up, or oh, my bladder doesn't work as well, or my muscles aren't as strong, or I have to go for another colonoscopy, or I'm taking blood pressure medicine or diabetes medicine, right? So we can measure it in the medications that people take. So how do you measure aging? That's a really kind of fundamental question. And then what if you put in what you wanted it to be? What if you put in what it should be for a 30-year-old, right? And those things are important ways to start thinking about the metrics related to aging. There are metrics related to aging, particularly with blood pressure. So in 2013, there were the antihypertensive guidelines that were set based on decade of life. And they basically said like 120/80 is great, a little bit less when you're really young, and then you can handle 160/90 when you're in your 80s because you need that pressure to get blood supply against gravity to the brain. So there is some inherent calcification that occurs in the arterial wall as a result to increasing blood pressure to the brain. So people don't fall because their muscles aren't that great and their bones are not that great and they don't want to fall, right? And so when you look at that as kind of a metabolic aging process and why it exists to protect the brain, we keep the blood pressure higher, even to the point that people in their 80s can have blood pressure 160/80, 160/90. And if they're native to blood pressure medicines, they should not get started on blood pressure medicines. That's what the antihypertensive guidelines said in 2013. These were decided on, and that was more than a decade ago. So we kind of adapt to aging in blood pressure. We have adapt to aging sometimes in kidney function, you could argue, because there's stages of kidney function. And so as people age, sometimes they lose kidney function and they have a progressive staging of their kidneys. What about colon health, right? At some certain age, people start having their colon visually inspected with a colonoscopy. Then when that happens, they will go in every X number of years, 3, 5, 10 years, depending on what the visual inspection results. We use that as a sign of aging. The colon is aging. There's some abnormalities potentially in the cells, so we want to look at that. And then, of course, there's also breast evaluation for concerns for cancer, those kind of elements that go on with that. So when we look at these ideas, the idea is how do we measure aging from a medical perspective? How do we accept aging? And then how do you measure aging? And what do you want your aging to be like? What do you want your health span to be? Well, I want to give you a 3-step process to age backwards with cellular repair and longevity hacks. And I have to tell you that when I first heard this concept, I was like, I don't even know what you're talking about. Really, seriously. Because I was really hung up on this idea of like chronologic aging. And there's really not anything you can do about that, right? You just age chronologically. But metabolic aging is where it's at, right? Metabolic aging is where you can Be in control of your life. You can maintain vitality whatever decade you're in. And I have people that come into my office and they've been playing tennis for 50 years. They have an accident or injury or whatever, and they say, do I have to give up tennis? And I'm like, no. Never give up something you love. Let's just make sure that we help you heal and stay in the game or get back in the game. Don't give up the things that you love. Maybe that's another way for framing your way to measure your life and health span and what you need to do to make sure you can keep those things going in your life. We have patients in my practice who love to ski and patients who love to hunt and people who love to be on the water, and they just don't want to give those up, and they don't have to give them up. And I think that they need to recognize that. Yes, there are some times where there's injury, but we need to get the body stronger. In essence, we need to age backwards. Supercharge your mitochondria for more energy. The mitochondria are the power plant of the cell. They want to do work. They want to produce energy. They want to be challenged a little bit so they can get stronger. And it is something interesting to think about, like a part of your cell getting stronger. But you have to just think about it, just this fountain of youth idea, right? Aging backwards, making your mitochondria stronger. We want to fix energy crashes. The mitochondria are critical, so we know how to make them stronger. Short bursts of exercise, right? This gives it a little bit of a challenge. And then just how the body works, it likes to meet that challenge, right? That includes cold exposure, sauna therapy. Definitely fasting is very significant for mitochondrial health. Other things like the mitochondria love support. Okay, they love NAD, they love CoQ10, right? These are they love nitric acid, they love niacin. Like there's just like EGCG. There's just so many nutrients that the mitochondria thrive on. We need to make sure we're feeding the mitochondria. The other tip, reduce inflammation, okay, or inflammaging, which is inflammation plus aging. There's definitely hidden inflammation accelerators. One, chronic stress. That's elevated cortisol. You can check that. It's a value called glycated protein or GSP. You can check arachidonic acid. Okay, that's an omega-6. That's pro-inflammatory. You can look at HSCRP. So those are a few markers to show you some inflammation in your lab work that might be happening on the inside, but you might not necessarily appreciate what's going on because you're just kind of going through life and you feel the stress, but you don't know how much it's playing in on their actual metabolism and how much it's inflammaging when you're adding the inflammation and you're getting the accelerated aging. Blood sugar spikes, processed food, stress eating, plastics, environmental chemicals, mold. These are all hidden inflammation accelerators. So what do we do to fix it? Daily anti-inflammatory habits. There's so many things to do. It's the exhale first method, mindfulness, which we talk about. Sometimes mindfulness is just being aware. It's grabbing a glass of water before you grab something like a sweet processed sugar. So you're like, okay, if I hydrate, maybe that will satiate my brain because we're often very thirsty. And when we hydrate, we do satiate a portion of our brain that is right next to the eating portion of our brain. It's pretty cool what our body does. Second, polyphenol-rich food. So berries, greens, green tea, turmeric. Polyphenol is just about eating really yummy fruits and vegetables and spices and they are so rich with repair. It's just critical. That's why so many people are leaning towards these green powdered drinks or red powdered drinks. And it's really because it's concentrated fruits and vegetables. Why people have always talked about fruit smoothies. And some people argue, well, that's a lot of carbs. And I hear you. But when you're looking at polyphenols, those are so impactful for repair. And you want to up your fruit and vegetable load. And a lot of times people do that by condensing them. Then there's other things to fix hidden inflammation accelerators. Omega-3s, collagen, magnesium. There's a lot of other things that we can talk about as we dive deep in our membership, because these are overview things and they will definitely help a lot of people, but we've got to get that strategy in place so that these get very organized and you're in control of your body and you're making it work and you're understanding the how and the why. So tip 3, activate your longevity genes. There are many ways that our body is designed to heal. Call them built-in repair mechanisms. They're key strategies to turn them on. So intermittent fasting, it lets your body rest. Your gut takes up a lot of work. Time-restricted eating, which is like eating within a window, like 11 a.m. to 7 p.m., and then not eating from 7 p.m. to 11:50 or 10:59, right, or 11 a.m. Eating in an 8-hour window is very helpful. Some people can do this quite quickly, and that's fantastic. If you jump on intermittent fasting, it makes tons of sense, and your body's like, thank you. And then other times there's people who try it, and it's even harder. It makes life even harder. If that's the case, you don't want to give it up. You want to put it on hold. So sometimes one of the ways to activate your longevity genes is to recognize if you try something and it should work, why did it not work for you? And intermittent fasting or a window of eating should work for most people because it lets the gut rest, including the colon. It just allows the body to give time to heal. If it's not working for you, put it on hold. And then it's definitely something we talk in the membership. We walk people through that because you ideally want to use intermittent fasting and an eating window for health. Prioritizing deep sleep. In the Johnny Carson era and social media era, we somehow have ignored the value of sleep, but it is so important. You can also use sleep in a middle day nap. This will help your repair genes. Using sleep between the hours of 2 and 4 for approximately 20 to 40 minutes will allow your body to rest and not have a huge slump. This will help your built-in repair mechanisms. And then, of course, reducing toxic exposure. Toxic exposure is very disruptive to your genes. They can be hormone inhibitors like pesticides, even household products, which are often a lot of aerosol, will get easily into the body and they have a toxic level. So make sure you're using those things judiciously. And the other thing is products that you can purchase that are much closer to cosmetics than healing. And unfortunately, that's often skincare. People get into skincare and even some, just let me say that even things that are labeled as good for you, you have to know where you're getting that source. And the cosmetic industry is not very well regulated. And remember, there are many skincare lines that are much more about cosmetics. They're getting a quick result that doesn't last, and it's loaded with toxins. In fact, I just saw a commercial the other day, and the woman had like blasted these lips open. So those lips look great, right? They're full, they're plump, they're shiny, and it's very clear that there's a very toxic element in this lip cream that is aggravating and bloating the lips so that they get swollen. Instead of using something like vitamin C or collagen support or good healthy oils that actually nourish the lips so that they'll release the tension and spread. And it was kind of disheartening because, when you see that level of inflammation that's going on by adding a cosmetic, it's very disturbing because it's the result people want, but it's not going to last, and it's a big toxic exposure. It's really going to affect the longevity genes. Also, consistency matters and why you need a system and not just tips. One time my patient came into my office and she was like disturbed. She had these 3 books and they were all really good books on eating, right? I think one was Dr. Terry Wahls, one was not Jill Kahn, but it was the plant-based Dean Ornish. And then another one was maybe J.J. Virgin, and they're all really great authors, all really great conversations about diet as food as medicine, but they're tips, right? Because none of them knew her, none of them had worked with her, none of them had a system for her necessarily, and they were all designed for different groups of people with different needs, right? People who had different ways of accelerated aging. And so she needed a system, and then she needed consistency within that system. And most people struggle with consistency, right? They might understand a little bit of a system. Truly, most people don't have a system about their health. They just kind of expect to be okay, and then when they get sick, they go to the doctor, and then they expect to be sick, and then they just kind of let that run its course. But when you actually look at healthy and long-term health objectives, then you look at strategy, system, and consistency within that system, which means you might have to also recognize consistency comes with some accountability. First to yourself, and then with the support of others. This really matters. And that's what we offer in our membership. It's important to have step-by-step, easy-to-follow longevity strategies. It's important to track progress and stay accountable. It's very important to receive expert guidance and live support to personalize your healthy aging approach. So what do you do next? So we've unpacked the reasons behind premature aging, accelerated aging, and why some people seem to have vibrant, energetic, and sharp minds and bodies, while others struggle with fatigue, brain fog, chronic inflammation, and progressive comorbidities and disease. And the truth is, aging isn't just about getting older. It's about how your cells function today. But what I love the most of all is that you are in control of your body, and you can change this. You are not stuck with a slow metabolism. You are not destined to feel off or past your prime, and you don't have to accept brain fog, fatigue, or joint pain as a part of getting older and therefore a part of the rest of your life. This is where the transformation happens. I've worked with countless patients who thought they had to accept declining energy and chronic symptoms as just part of life, until they learned how to work with their body. Here's what happens when you stop guessing and you start optimizing with a strategy. Energy levels rebound because your mitochondria get stronger. Inflammation reduces, allowing your body to heal, repair, and even feel lighter. Mental clarity returns. Your brain starts to thrive on stable blood sugar and oxygen. And aging slows down at the cellular level because you're giving your body what it needs to function optimally. And this is exactly what we do inside the Feel Better, Feel Great membership. This isn't just a place to learn, it's a space for transformation. Inside the membership, we don't just talk about these concepts. We actually apply them so you can see and feel results. This membership is about helping you turn knowledge into action, so you don't just listen to podcasts and think, oh, that sounds great. But instead, you actually start feeling better, stronger, more in control of your health, and possibly start to feel great, and then you stay feeling great. If today's episode resonated with you, this is just the beginning. Doors will open soon, and I'll be sharing exactly how you can be part of it. For now, here's what you can do. Make sure you're on the email list. You don't want to miss any announcements. Stay tuned for the next episode, where we'll be talking about how your nervous system holds the key to healing, stress resilience, and faster recovery, and also the ownership that you need to be in control of your health and your life. I can't wait to take this next step with you. More details coming soon. Stay tuned.